Hi, today is day one of actually recovering from a meniscus tear. For the most part, surgery went well. I was sedated, two incisions were made, back out after 20 minutes. Repair took about that long. Recovery took longer, about an hour, but it's supposed to. I'm a nurse, so the medications they used on me for sedation were really good. I asked for ketamine because there's less side effects of nausea, vomiting afterwards, and you wake up a lot faster and able to breathe on your own off a ventilator because they do put you on general anesthesia, which is a tube down your throat, and they help you breathe through the procedure, even though it's 20 minutes long. Surgeon came out. They did. I had a posterior horn repair, which is the back part. It's the most common part, and normally they don't actually stitch it together to actually shave it because it's easier and faster to return because it's in the white area versus the red area of the meniscus. Red area covers a lot of blood and easy and kind of self-fixing on its own. White area does not. It's older tissues, so they just shave it, and your recovery time is supposedly cut in half. This is going to be, that was day one. I did use one Percocet. That was about it. And then I've used Motrin most of the time after that. Other than that, we're working on day two today. Day two consists of still the foot pumps with your foot, like you're putting a brake pedal, gas pedal, and rotating your foot this way to stop the blood clots. I am on an aspirin every day to help me with blood clots because that's very common with this procedure, but not really dangerous as long as you take your aspirin every day like they tell you to. Other than that, my leg's been in this position on a chair right now for breakfast, but usually three pillows elevated with a bag of ice on top of it and a bag of ice underneath it. These are my best friends, but for the most part, I only use them to get up and back and forth to the bathroom. It is a weight-bearing procedure. If it's this simple, it is more complex ones. I did have a cyst in there on my ACL. It's not considered that, bad. So, he told me weight bearing immediately day two, and I've been weight bearing actually with the crutch assistance since day one. Actually, it's not been that bad. And today I will be weaning off the crutches, doing my physical therapy, which will be consisting of more leg exercises and some stretches, which I'll try to incorporate or either bring to you guys like after the fact. I cannot see my incision to day three. Then I'll take some pictures and some videos of that when I unwrap it for the first time. Supposedly this is two incisions. The swelling is the key. If you bring down the swelling in the first 72 hours, your recovery time will only be roughly between 1 and maybe 3 weeks. I am 51 years old, but I am rather healthy. I do run a lot and jog a lot, and that won't be happening anymore for a while. And I do play soccer actively. That's how I heard this to begin with. Other than that, I'm expecting a pretty good day today, even considering the physical therapy piece, but that's all part of the recovery. Hopefully, I gave you some information. If you do have any questions and stuff or comments, you're more than welcome to visit the website here and click on it. There's a link maybe with it, and ask me anything you like. I could tell you a lot of stuff being a nurse, what to expect, even with the most intense tears. I worked in orthopedics for a long time, so this is just old hat for me, but just not being on this side of the bed, more being the person telling you what to do versus the person actually doing it. And nurses make the worst patients, so we do over push ourselves, which hopefully I will not do, and I'll behave myself. Other than that, guys, have a great day. Hope you guys all wish me a bunch of good luck. Physical therapy just consists of me sitting at home and doing all the stuff here. I see the doctor in 7 days post-op visit. Then I'll really start the physical therapy with the physical therapists 3 times a week and try to get back to work. My goal is to try to get back in 2 weeks at 51 years old. That might not seem old to some people, but I just tell people when you hit your 50s, it's not downhill. It's just a rocky road that we all need to learn to be able to get through. And I said, like I tell people all the time, the only limits you have in life are the limits you put on yourself. You can conquer anything with a positive attitude. I'm not the most positive person, but I try to live it as much as possible. Guys, have a great day. Thanks for your time. Take care now.